When the state medicates away children's grief, antidepressants and LVU are a betrayal of the child's brain. Giving antidepressant medication to young children who have been placed under LVU is a serious systemic failure. It is not the child's brain that is ill, it is the child's life situation. When the state separates children from their parents and then medicates the child's reactions, it medicates away grief, attachment, and humanity instead of taking responsibility for the trauma it has created itself. A child protests, and we silence it. A small child who cries for their mother is not mentally ill. A child who cannot sleep after being torn away from their family is not depressed. A child who becomes anxious, aggressive, sad, or apathetic after a forced placement does not suffer from a chemical imbalance. The child suffers from loss. Yet society increasingly responds with medication. Antidepressants, sedatives, drugs that suppress, silence, and make the child more functional, but at what cost? Young children's brains are not fully developed. Young children's brains are extremely malleable. During the first years of life, neural connections are formed at a rapid pace. Emotional regulation and stress systems develop. The foundation for attachment, empathy, and trust is built. Serotonin, which is affected by antidepressants, is not merely a feel-good substance. In children, it is a regulatory system for brain development. Chemically manipulating this system at an early age risks altering how the brain is organized for the rest of life. This is not speculation, it is basic neurobiology. Placement under LVU is in itself a trauma. When a child is forcibly placed, attachment to the parent is broken. The child's stress system is constantly activated. Grief, fear, protest, and despair arise. These reactions are normal. They are signs that the child's attachment system is functioning. The problem is not the child's reaction, the problem is the separation. To medicate the child in this situation means treating a human grief reaction as if it were a disease. Medication is used to make the system function. In practice, antidepressants are often used to reduce the child's protests, make the child more manageable in foster care or institutions, dampen longing for biological parents. When the child cries less and protests less, one says, "Now it works." But calm is not the same as healing. A child who has stopped crying may just as well have given up. What we see in reality: children who are medicated after placement are often described as emotionally blunted, passive or apathetic, less expressive, well-behaved, and quiet. This is interpreted as improvement, even though the child in reality no longer dares to express grief, no longer receives help regulating emotions through relationships, learns that emotions should be shut down, not understood. The child's signals disappear, and with them, the child's voice. What does the child learn? A small child learns through experience. When the child is sad, right pointing arrow receives medication. Misses their parent, right pointing arrow is chemically subdued. Protests, right pointing arrow is corrected. The child learns that my feelings are wrong. My grief is a problem. My attachment is something that must be removed. This shapes adults who struggle to feel, struggle to form attachments, struggle to trust others and themselves. But sometimes medication is needed. Yes, there are extreme exceptions. But young children very rarely suffer from biological depression. In most cases, it is about separation, trauma, insecurity, environmental factors. Prescribing antidepressants in these situations means treating the symptoms of a systemic problem, not the cause. Medication should never replace secure attachment, continuity, relational support. Work with the child's actual life situation. What does this say about our society? What does it say about a country when we take children from their parents, view the child's grief as a problem, and solve it by suppressing the child's brain? Is this child protection, or system protection? A moral choice. Children should not be chemically adapted to a system that harms them. The system should be humanely adapted to the child's needs. Antidepressants given to place children risk silencing the child's pain, hiding the consequences of forced placement, creating lifelong harm instead of healing. A society that cannot tolerate children's grief is a society that has lost its humanity. Children do not need to become less sensitive. Adults and systems need to become more responsible.